for coming to, this is our third now behavioral health quarterly meeting. And, we're excited to present topics that are helpful, to everyone. And thank you all for those that submitted feedback from the last presentation and questions and topics of interest. So we're definitely taking that feedback and incorporating that into our agenda. So thanks again. And hopefully everyone has the flyer that indicates, our next couple trainings and the dates. So reference that for upcoming trainings and if you need invites. So without further ado, just wanted to maybe do a little housekeeping. We've already mentioned that if you could turn off your cameras during the presentation and mute yourselves and let our presenters be first and foremost so we don't have any challenges with hearing, that would be great. And so I'll talk real briefly about who is presenting. We're very thankful to have a presentation on data and graphing. Sandy Appeloff is a developmental specialist in the South region in private. She's also a BCBA supervisor, and she sits on PRC in the South region. So she is here to share her hands-on knowledge of Excel, and hopefully, to help everyone get the most out of their data, both, practically in terms of use for the individuals in your teams, as well as when you're presenting for various entities such as PRC and URR and resource management and licensing and things. So we appreciate her expertise. And then secondly, Amy Fazekas is a clinician at We Do Life Together, which is a division of ISIS. She is our West Region Clinical Response Team clinician alongside her supervisor, Stacy Prophy. So we did ask Amy to come and share her TheraP skills with us when it comes to graphing and designing the data input systems. So we are very thankful to receive her expertise today, and hopefully that'll help everyone use TheraP most helpfully when you present, data and graphs. And I know with the recent changes and adjustments to TheraP, probably this is a stressful time, and Amy won't be able to get into everything with TheraP, but at least when it comes to producing data and graphs. So I'll shut down my face and welcome Sandy to begin. Thank you.
Good afternoon, everyone. I just want to make sure everyone can see the presentation. Is it showing? Are you able to see it?
Yeah, absolutely, Sandy. Looks good.
Yes. Okay. So the purpose of the presentation is just to review the DDS requirement for data-driven treatment. And which, is important not only just for PRC presentations and things, but also, data-driven treatment for your program development, revisions, team meetings, monthly reviews, quarterly reviews, to review medications with the doctors, prescribing doctors, and also for PRC and HRC, which I think is why a lot of people wanted to go over this presentation. So like Brooke had said, we want to review TheraP and Excel primarily today. I know there's other graphing options, but for the most part, it seems most agencies are using those two. So hang on. Having a hard time getting it to go. So specifically, the requirement regarding data collection and graphing is in the regulation for behavior support plans on page 6. And what is required is that we record data on individuals' behaviors of concern, which are targeted by medication and aversive procedures. That we're recording data on individual skills that are being built as an alternative to the behaviors of concern. And that we review data periodically, determine if changes in the individual's positive behavior support plan are needed, and that data is shared with all individual support staff and with any physician or APRN who has prescribed the medication. Any change in the medication or dosage shall be based upon the assessment of the individual's longitudinal data. So I just want to talk about that just for a minute. Sharing the data with the individual support staff is really important to show them how well they're doing, the effects of their job, and they're much more committed to gathering correct and reliable data. If it change, it's very reinforcing to look at that graph and to see what a great job you're doing, and you can use that to really reinforce your staff and for training. Sharing the longitudinal data with the doctors is extremely important. So they can see the effects of the medication. So it's very important that the data be correct and all the information be on the graphs for that review. So develop and graph comparisons between the individual's intervention data versus his or her baseline to determine whether the treatment is effective. Graphs that are easily readable allow for the opportunity to evaluate treatment effects on dynamic behavioral changes. So baseline, the initial baseline is prior to any interventions. And I know we've asked folks to make sure you have a up-to-date baseline especially for PRC reviews and things. We're not asking you to stop your intervention plans or discontinue medications or anything to get a true baseline again, but to give an annual average or quarterly average or something, just to have a current, where are they at right now, so we can see, the effects of treatment, how it's going right now. So make sure you update that, and really important to put that baseline data point on your graphs. Okay, annotate interaction effects on the graph, such as any medication changes, if you revise your behavior plan, if there's a change in medical status, they go back to day program. All these COVID restrictions certainly should be showing on the graph, how behaviors change quite drastically for a lot of folks. Any significant changes in people in their lives, staff that have been there for a long time and may leave, or new staff coming on, can really affect behavior. It's also helpful if you do an interpretive summary of the data, maybe below the graph, just explaining what's going on, some sort of notation. Your graph, if everything is on your graph and the phase change lines are there and they're all clearly labeled, everything's there. But sometimes there's a little bit more information that's helpful to just kind of summarize, what went on during that time period. Okay, so what's needed to meet these regulations and policies? How are we going to do this? Numerical data and graph for positive target behaviors to increase that are functionally equivalent to the maladaptive behaviors. Numerical data and graph for maladaptive behaviors that are part of the behavior support plan and or treated with other interventions, such as medications or therapy. Graphs need to display the effect of treatment by showing the rate of the behaviors under the conditions of the treatment and changes made to the treatment. Define and label treatment interventions using the phase change lines, text boxes, or narrative notations. PRC requires head hits to be graphed, showing the frequency and intensity. So defined as mild, moderate, and severe. For the most, I know you guys know this, and for the most part, people do a great job identifying them and defining them as mild, moderate, severe, but not necessarily displaying them on a graph. So we wanted to do that today for some examples of that. And also the restraint data and graphs need to display the type of restraint, the frequency of the restraint, and the duration of the restraint. And PRC HRC requires data to justify the benefit of any aversive or restrictive intervention. So any of those interventions you're using, we need to have, the numerical and graph of the implementation and how it's affecting the rate of the behavior. Okay, so these data and graphs are also needed, for quarterly behavioral reviews. They're not just for peers, HRCs. So quick document revisions, like I've mentioned, but they're also used for URR. Case managers may ask for them for URR review to include in the packet, or resource management needed for annual performance reviews. So I want to show you some sample graphs and that meet these requirements. And then after I show you a few, we'll talk about them a little bit. Then we'll jump into Excel and actually develop some graphs, design some graphs. Okay, so one thing I want to ask you to do is just let go of that misconception that PRC wants only one piece of paper with all the graphs on one, or one graph with all behaviors on one. Graphs need to really be designed in a way that you can analyze what's going on, you can present it, it can be easily seen by others. To know, what's happening, what is the target behavior, what's that goal for the target behavior, what are you doing to reach that goal, and how is it going? The graphs really just need to tell the story, what's going on, what's working, what's not, and what are you doing about it, kind of thing. Okay. What's up here? Okay, so this is a targeted maladaptive behavior in the effects of the medication. And it is the target behavior for this are defined in the behavior plan. And for this individual, it happened to be aggression that led to injury, and any property damage that led to destruction, and then the use of emergency interventions, which was PRN medications, restraint, or 911. So this is displayed on here. A line graph is used to display the rate of the significant incidences, and it's measured on this axis, which is a frequency count, total incidences per month. And the bar graph here is the medication. The intervention for, or the treatment for this target behavior, these incidences, besides the behavior plan, was the prescribed medication from the doctor. So we wanted to put both the medication and the behavior on the same graph, so that when we sit down with the doctor and review how's it going, he can really see at these doses, how the rate of the behavior changed. Okay, and then so the medication is a bar graph, and it's measured on this axis, which is the milligrams of the medication. So you have both the primary and the secondary axis showing. All your numerical data is down here, which we're going to get to how to do that if anybody doesn't know how to do that yet. Okay, this graph is the positive target behavior and the maladaptive target behavior. So it will show, the target behavior for this individual was a frequency of aggression to others, and the function of that behavior for this individual was if somebody asked him to do something he didn't want to do, he hit them as a way of saying, no, I don't want to do this. So again, your baseline points are here for each of the target behaviors. The aggression to others is this orange line graph, and the positive target behavior is the success of communicating no appropriately. So these are both line graphs on one graph, which is fine, because we don't need the secondary axis because it's both a frequency count. So again, your baseline data points, he's at 0 for saying no appropriately, and about 10, a month for the aggression to others. So you can just see how the behaviors, the rate of the positive behavior went up, the rate of the negative behavior went down. This is a frequency of aggression to others and environment. In the intervention in place for those two target behaviors was a timeout procedure. And sometimes that individual needed to be escorted using a PMT escort to get to the area where the timeout procedure was implemented. So for this graph, it clearly shows how the rate of the behavior changes when the intervention is implemented with it. So again, the target behaviors, aggression to others is this blue line graph. Aggression to the environment is this green line graph. Those are measured on this axis for frequency per month, total per month is labeled. And then the interventions are bar graphs. The brown one is the timeout procedure, and the navy blue one is the escort. So you can see how the rate of the behavior went down and therefore needing also the need to implement the aversive interventions decreasing. Something like this is very, very helpful because you can see that the rate of the aggression towards others went down, but the rate of the aggression towards the environment did not. It is not decreasing. So I don't need to do a complete overhaul of my behavior plan, but I may want to, looking at this graph, may decide that I definitely need to do something about the intervention for aggression towards the environment, figure out what's going on with and change that. This is a sample of graphing the restraints. So again, we need to, you need to graph it needs to show the type, the frequency, and the duration. So the type, your title, PMT escort is the type of restraint on this graph. And the frequency of those escorts is the blue line graph measured on the primary axis. The duration is a bar graph measured on the secondary axis as duration of minutes. Make sure you're labeling all these axes. Otherwise, we don't know what we're looking at when reviewing at PRC. But also, again, remember you may be reviewing these with a doctor, with the team, with a guardian, and your staff. The floor controls on this side, and same setup. You could put both on one graph, but as soon as you start putting multiple behaviors on a single graph, it's going to be critical that you are paying attention to the colors and that they're different colors, so it makes it easily read. And also maybe changing the markers and things. The more you have on a graph, the more complicated it becomes. So sometimes it's easier to read them. And again, not only for who's looking at them, but for you to be able to tell your story when you're presenting and be able to look at that and know exactly what's going on. So this is graphing head hits, mild, moderate, and severe. So for this one, they're all a frequency count, the number per month, and the blue bar graph is the number of mild head hits. The orange line graph is the moderate head hits. And this gray area, it's called area chart, are the severe head hits. So it makes it easy to see what's going on. So while it shows, a specific graph shows that the rate of the severe and the moderate head hits has decreased and is at low rates, especially the last 4 months, which is great. You can clearly see that mild head hits is increasing. So something needs to be done. So any head hit is not good. Okay, this is a graph with labeled phase change lines and narrative summary. So the target behavior for this individual was aggression, and it is a frequency chart, total per month, total number hits per month. Here's my baseline data point. And when baseline ended and put a behavior plan in place, the phase line was added. Labeled redirection with calm hands is what changed. The rate of the behavior started to go up, but still significantly below baseline. So then starts coming down. Again, we met with the doctor at this point, and the decision was made to decrease the Ativan. So this is where the narrative might come in handy, because some people may say, only 2 months of a decrease and you decreased a med already. But Dr. Brown decreased the Ativan on 8.5 based on progress noted, those 2 months down, and a concern with sedation. So, there were negative side effects that, had to make a change. So the behavior starts increasing, and unfortunately, typically what happens when we see, make a med change decrease and we start seeing behavior increase is you're tempted to call the doctor and say, this is what's going on, and they may increase that Ativan again. However, remember, we have this negative side effect, the sedation, so that's not necessarily an option. But also, the note goes on, aggression began to increase because Joe had more energy and he appeared to enjoy the attention from staff. So that tells me that this is really not about the medication, this increase, it's just the behaviors being reinforced. So I don't need to call the doctor and shouldn't be calling the doctor at this point to increase the med. I need to do something with the behavior plan to make sure the attention is being given for the appropriate behavior rather than the aggression. So that's what was done. Rate of behavior drops down. Okay, so sometimes there's more information in the narrative that isn't really showing on your graph. This is a graph of that may be what you present to HRC. It's certainly PRC as well, but the data to support the need for restriction. So this is, restrictions like locking chemicals, locking up sharps. In this particular case, it was restricting media access. So sometimes we're limiting access to the internet or cell phone use or something. So this is the dreaded inappropriate sexual behavior. And for this individual, it was broken down into verbal, inappropriate sexual verbal behavior, inappropriate touch, and an inappropriate sexual act, which was exposing himself. So the baseline for this is actually taken from the number of incidences, number of incident reports. So it was a record review to get that baseline. If for other things is sometimes, it's really hard. We want to hold officers that are, a risk to health and safety. So getting your baseline from your record review, or sometimes one incident is, enough before we're going to put this restriction in place. It happens, so it justifies the restriction. So count that as your baseline. Graph it as number frequency of incidences, or single point is fine for this. Just explain what that is, where that was from, define it, what happened. You want to be able to say, why you had to put this restriction in place. So again, phase change line, frequency incidences per month. They're all line graphs for the 3 target behaviors. Restriction was put into place here. And obviously, we want to be able to see downward trends of this behavior, but it justifies, there's still, yes, it's going down, but it's still pretty high rate behavior for this particular behavior. It's pretty risky behavior. It could really cause a lot of problems for this individual. And remember, he's targeting other people with this behavior. So it is justified to keep the restriction in place, but add the positive target as well, to teach the appropriate social sexual behaviors. Okay. And again, your tables down there, so all your numerical information is there. So keep in mind, without data, you're just another person with an opinion. So we've all been in that situation where different staff take our individuals to med appointments and don't go with graphs, or don't go with an understanding of the graphs you gave them. They're supposed to review, and sometimes medication changes happen that are not data driven. It depends on the, staff person did an overnight last night, is really super tired, and that individual hit him this morning. So they go in and kind of convey that he's awful, he's very aggressive and things, and you may see a med increased. We've had guardians, I'm sure, at times, or staff, or that just want a med change for whatever reason, either more or less for some reason. So when you have your graphs and everything is clearly labeled and it's the behaviors there with the intervention, with especially medications and things, it's very clear. It's the facts in front of you. So you don't get med changes happening, based on opinion. It's based on the data, which is what we need to do. Okay, let's jump into Excel. And I'm just going to let me know if you can't see this. All right, I'm sure you all know how to do a basic graph on Excel, so I'm going to go through this pretty quickly. But the reason for going through it at all is just to get some of those elements on the graph that we talked about and that are needed. So I'm going to do months, and for always first thing, baseline. I like to skip a line so that the baseline data point is not connected with a data path to the intervention, because they're not related. So I'm sure there's a different way to do that, but that's the easy way to do it. Just skip a line. So this started a year ago. Oh, once you get 2 down there, so Excel knows what you're doing, you can just drag it for the rest of the year. Come on. Okay. All right, so this behavior is the frequency of skin picking. All right, set up, and then you just start entering your data. So baseline for this individual was 20 incidences in a month. For the sake of time, I put the data over here so we can just move it. Oop, lost one. So you have your basics, and then you're just building your graph. So highlight it, insert. Excel calls them charts. I usually pick the line with markers. All right, and then you just start adding your elements that we talked about that are needed. So once you're clicked in your graph, you see this little plus sign to add chart elements. So we want the title, and for this it is, you see it dropped it right here, and it's in the little box. You can just type in what you want. So frequency, skin. Okay. And at my table. So this is where you add that data table, and it is just going to drop it. It's that easy. So this is the only thing you need to send in to PRC, because your numerical data is right here, your graph is right here. Okay. Just move this over a little bit. So again, really important that you're labeling, what each of the axes is. That one's months, but and what the, oops, sorry, get down there. Trying to cover up my 28. Okay, so the other thing I just want to show you is the phase change, how to do the phase change lines. So Excel automatically scales. I'm sure you know this, but Excel automatically scales a little higher than your highest data point. So this is a 31 is our highest data point. So it scaled it to 35. So what I want to do is drop a line at 35 to 0. If you do it this way, rather than inserting the shape, the line that you draw, it will stay put. It will stay on the date where you want it. The lines move. You have to remember when you're doing your graphing, if you draw in the line, you have to constantly be moving that. It's a lot of work. And when you're getting longitudinal graphs that are going to go on for a year or more, probably more, it's a pain in the neck to keep moving those lines. So if you do it this way, it stays put. So I'm doing that as 35. And I want to add that to my graph. So if you right click in your graph, select the data, I want to add phase change. You got to get rid of this little, and then just highlight this column. And so moving forward, every time you add a phase change, it'll go in there. All right, so what, oops. So it dropped it as a data point, as a line, like it would be a line graph. I want to change that because I want it to look like a phase change line down the graph. So right click on the data point itself, change the series type, and I want to make this a column because a column looks like the line. Okay, and so you see, because I entered 35, it again scaled it higher. So I like to format access, change that back to. Okay, so now we have our graph that's showing our baseline, our phase change, and then the data ahead. So what happened here is we changed, we started a DRO with hands down. So label, so we want to label that. We want that on our graph. So if you click on that data point, you see how those little 2 dots show up. Right click, add the label, and that will just label this data point, this line. And you see how it says 35 because that's what I entered over there. And now right click again. I want to edit text because I want to actually write what I did. So DRO is hands down was the intervention. Whoop. Correctly. Okay, so it is labeled. You can move this where you want it, but this description will stay connected to this line forever. It won't keep moving. And you see it even draws a little line. So so then in December we had another phase change, draws the line. May we had another. I won't take the time to label all those right now. But let's say in March you had you didn't change the program, you didn't change medications or anything, but you had a day in March that he had a dental appointment. So you PRN pre-sedate Ativan. So 1 milligram Ativan was given on 3/15. So I want this on my graph because it might affect the behavior on this day and the next day because he had that pre-sedate, but I'm not dropping it as a phase change line because it wasn't a permanent change. It was a one-time, one-day thing. So if you point to that data point with your cursor and double click, then you see how just that point is highlighted, and right click, add the label. So it works just like the phase change. Oh, sorry. Go away. Edit my text. 1 milligram Ativan. And you can change the size of your font and everything to make it not stick out so much if you don't want to. So move that box exactly where you want it. But it will stay connected to that point. So again, moving forward. Well, get over there. I don't know why. There we go. Oh my goodness. It really does, guys. There we go. Okay, it will stay connected to that point as you enter more data. And so see the next day, the behavior was lower and it probably was related to that Ativan. All right, so those are the basics on that. So I want to just go back and do one that's more realistic for PRC presentation. All right, so this is your PRC cover sheet that you send in. So this, your positive target behaviors, complete daily responsibilities, requesting a break. The maladaptive behaviors, declining to complete daily responsibilities independently or with support. The agitation, aggression in environment, aggression to others. There's a PMT one-person escort. There was a PMT floor control two-person, but it's been discontinued. And then there's a timeout from reinforcement procedure. So we need a graph that are going to show these 6 target behaviors and the restraint procedure and the restrictive procedure. Okay, so whoops. Away. There you go. So I want to go back to Excel. So there's target behaviors that were listed on the cover sheet with the phase change, a column for the phase change, my baseline, place for my baseline, and the months. Okay, so after we get this all set up, which already has been for you, we just need to enter the data. And so for the sake of time, I did already enter it. Make this a little bigger so you guys can see it better. All right, so building this graph. Highlight everything. Drag it down. Insert. I always do the line with markers and then you can change it to what you want to be. I just find that easier. You don't have to do it that way. Let me just pull this down a bit so I can. Okay. All right. So this is pretty typical of something that may be sent into PRC. So you see how you have every target behavior on one graph. So there's problems with this because this is percent completing daily responsibilities on the same graph as a frequency count of adaptive behaviors. So we have 2 measurement systems on one graph with only the one axis showing not okay, doesn't work, squishes everything in here. So it's very, very hard to read. Also, again, multiple behaviors on a graph, all these different colors. If you don't have a colored printer, can't send it in color. Sometimes, you know, when you make a photocopy, it's black and white again. It becomes impossible to read. So let's go. Okay, so highlight the chart, insert it. Okay, there's several options to how to graph this. But please don't put them all on one graph like I just showed you. So some suggestions. You could have one graph for each target behavior. You could have one for the positive target behaviors, one for precursor, one for maladaptives, one for the aversive interventions. By topography, so similar function or same function for all the behaviors that have the same function, or the target behavior associated with the aversive restrictive intervention, like I showed you with the restraints and the timeout procedure with the aggression and things. So I'm going to do this one. The one for positive target behaviors, one for precursor, one for maladaptive. So I need 4 graphs. So again, let me get back to my graph. Hopefully this is large enough that you can see it. All right, so putting it all on one is going to save me a lot of time. And the reason why I put everything on one is exactly for this reason. So I'm just going to copy it and make my 4, and then I can clean them up to be what I want them to be. So All right, so the first thing I want is all the positive target behavior. So I'm in my graph, I'm clicked in my graph, and I'm going to right click, select my data. All right, so I only want the target behavior, so I'm going to uncheck all the maladaptive behaviors and the interventions, but always leave your face change because it affects all of them. Okay, so just click OK. And you guys can't see it. All right, so it changed it quite a bit. We still have a problem though. We still have two measurement systems going on one graph because again, this is a percentage of completing daily responsibilities and this is a frequency of requesting break. So I want to change this one. I want to add a secondary access. So I'm going to click on that data point, the requesting break, change it, and I want to change this. I'm sorry, I want to add a secondary access. So I have two measurement systems to look at on here. All right, so this is now my percentage scale for the complete daily responsibilities. This secondary access is a frequency count of the requesting break. So see how it spread that out and it's much easier to read. He looked pretty flatlined on the requesting break and it looked very, very low, like maybe once a day, but you can see it actually is much higher. All right, so now we just add our elements. So again, we want the titles. So this is percent complete daily responsibilities. And this is frequency of request break. Chart title is my positive target behavior. I don't need to list what they are up here because you have it down here. If you want to type those out what they are rather than the initials, that's fine too. The only other thing I need is my table to have my numerical data. Okay. I just want to show you one more, just show you how it spreads out and then we'll move along. So this one will be my maladaptive behavior. So I don't want the positive on this graph. I'm sorry, my precursor behavior. So the refusals and the agitation. So I don't want my target behaviors on here. That's going to be a separate one. Uncheck the interventions, keep phase changes. And look how much it spread that out. So you can actually see the data paths now, what's going on with them. So again, you would add your table, your axes, label everything, and you're all set. Okay, so for sake of time, I'll show you the other two. So again, this is what, let me make this a little bigger so you can see it. This is what we had with everything on one. And again, it is a myth that PRC wants one graph. And this is what we have now. So we have, I'm sorry for all the jumping around, but I need to make it big enough for you to see. So the positive target behaviors, precursors, target behaviors, and then one. So you do have 2 or 3 or more behaviors on one graph, but not all of them together. And they're spread out and they're measuring the same thing on each graph. So maladaptive targets and restrictions and the behavior, I'm sorry, the baseline is showing. Alrighty, so let me go back to my slideshow. All right, so graph in a way that allows you to best analyze your data to determine effect. The graph needs to be displayed in a way for the reader to understand it. So again, this is typical of something we've seen. So this is Peter's behaviors. What behaviors are those? Oh yeah, behavior 1, 2, 3, 4, 5, 6, and restraint. So I don't really know what the behaviors are, and they're all jumbled up here. I can't really tell. So that compared to this. Another example is to graph in a way that really allows you to analyze your data. This is pretty common, that number of tasks done. People are graphing the frequency of tasks done. And the problem is if it's constant that the number of tasks that need to be done each day is 40, like this graph is showing, it's fine for you to do a frequency of how many they did do. And if I look at this graph, if he's supposed to do 40 things a day, which I'm assuming because it's scaled to that, he's not doing very well. It's really getting worse and worse and worse. But in reality, he doesn't have to do 40 things a day. It changes. So what's missing is how many tasks were required. So this looks like the absolute best day had 35, did 35 tasks in a day. On that day was actually supposed to do 42. So not too bad. But if you had graphed it as a percentage, so like this one is 6, he did 6 that day, he only was supposed to do 6. So that looked like his worst day. It really was his best day. So it tells a very different story. So graph it in a way that you can analyze it, how it's going. So if you didn't have this secondary information about the tasks that were required, you might look at this first graph and say he's not doing well. And reality is it looks like it was mastered. So, oops. All right, I will turn it over to Amy. And Amy, you can just let me know when you want me to move on with the slides.
There we go. Hello. So yeah, we're going to talk a little bit about TheraP now. So Sandy did a really great job giving the knowledge behind why our behavior is tracked, what we need to look for, how we need to present it to PRC, etc. So keeping that knowledge in mind, we're just going to take all that information and just move it into graphing using TheraP, which is a lot of agencies, a lot of people are using now. So we did go through some updates with TheraP recently with the behavior module changes. So everything on this graph is current with how TheraP looks today. So in regards to entering data, you're going to log into TheraP and you're going to go to the individual tab on the left-hand side, down to behavior data at that module and hit new. You're then going to select which individual you want to enter the data for. I didn't include that page just for confidentiality, but you can go to the next page. Or the next slide, sorry. So, yep, so once I've selected the individual I want to enter my data for, I'm going to complete all the required information I need to. And TheraP does a really good job with just, you know, putting it right out what you need to input. So just kind of go down the list. You're going to put the date in, your notification level, which is a newer addition to TheraP. A lot of times we just, you know, use low unless it's a major event or requires a 255. But once you've put that in, you then select your behavior, which would select whichever one you wanted to input, and then you enter the rest of the information and hit, you want to hit submit. So TheraP now requires you to hit that submit button instead of save, or else it's not going to get tracked to your graph. So just a reminder for staff that are inputting this data to make sure they hit the submit so that information actually gets recorded to your graph. So now that your information's input, you're going to start graphing. So again, TheraP's going to lay everything pretty much right out for you, what you need to enter. So the event date, you really want to think about what date range you need to view. If you're going to PRC or URR, they may need, 6 months to a year's worth of information. So you're going to select your dates from where you want the data to start until where you want it to end. And for this presentation, we're going to be doing interval data because that's how we've tracked the behavior. So interval data frequency is going to bring up, just the frequency of all the behaviors we've put in. You can track through percentage wise, but again, just for this presentation, we're just going to be showing the frequency. So then you want to choose the period. So what do you want your graph to show? And for PRC, URR, any of those presentations, we definitely want to choose monthly. It's going to be easier to view, easier to read. We're not going to have, a whole bunch of graphs on different pages by showing daily or weekly. So as, Sandy did in her Excel where she was graphing monthly, we're also going to graph monthly through Therap. Then you have the format. So for this presentation, again, we're going to show you the graph, but you can choose table if you just want a list of your frequency of your behaviors being displayed. So you can, display it that way. But again, we're just going to show the graphs for this presentation. And then the next question is single behavior per graph, yes or no? So this is going back to Sandy's presentation about how you want to display your graphs and how they're going to be the most readable. So do you want them all on separate pages? You're going to put yes, and then they're all going to be tracked separately. But if you want to track some of them together or display some of them together on the Excel, you're going to hit no. And then you're going to select which behaviors or which, behaviors positive or negative you want displayed together. So again, think about positive, negatives, think about, similar frequencies, how it's going to be easiest to read. So for this example, I've chosen, 2 behaviors of concern that we track for this person, and, they're similar frequencies, so it's going to be easy to pull up on the graph. So all you're going to do is once you're set with your range, what you want to view, what behaviors you want to see, you're just going to hit generate. So the next slide. And Therap's going to generate the whole graph for you. You can go to the next slide.
I'm trying, Amy.
Oh, sorry.
I don't know why it's gotten stuck.
If Amy wants to request control, oh, it worked.
Oh, there we go.
There we go. Is that the correct one?
This is correct, yes. So it's going to generate the full graph right there for you. It's going to pull up the information. It's going to title it for you. It's going to label all the axes. It's going to, pull up the frequency numbers right above the graphing line. So in this case, you don't necessarily need to add a table to it. You can if you want, but it is going to just pull up those numbers. And if you're graphing with, similar frequencies or in a readable, way, you're going to be able to read each of those numbers. So that's, again, going back to Sandy's slide and, figuring out the best way to graph your data. And it's really just going to pull all that information for you. It's along with, titling everything, it's going to also put in any phase changes. So that's what that little orange triangle is. I think that's over by March. So any phase changes you put in, and that's a new, new part of Therap that we can actually put the phase changes directly into the graphs. So it's you put that triangle there, and then underneath the graph, it's going to actually list what the phase change is. And on the next slide, we'll show how to actually input that. But you can add as many phase changes as you need, or significant life events. In this case, began a new job, but medication, any significant event, started a new program, PRN meds, anything at all, you're going to be able to list right into there. And to do that, back to the main Therap page, there's a new section called significant life events. And you're just going to hit new. And again, Therap pretty much puts everything straightforward for you. So it's going to ask you for the date, give you a description, and then you're just going to add and save it. So as many as you need to put in, it's going to save that all for you. You'll be able to view them, whatever you need to. And then once it's saved in there, it's going to automatically generate to your graphs. Actually, can you go back to the last slide? I forgot to mention one thing. So also just to go back to the graphing, at the very bottom of the page where it says comments, you can actually input anything you want there. So if you want to add your interpretive summary or narrative, you can add that right into the comments section. And it'll save it right into your graph. So when you're printing them off for PRC or sending them over to PRC, you'll have that information right there next to the graph. So that's another nice addition that they've added in. So you can go to the next slide. So yeah, so that was it about phase changes. Very simple, just puts it in and lists them there for you. And again, it's very straightforward how TheraP, especially with the new additions, has, really presented everything easily, just kind of follow the directions and it's going to pull up your information that you need. And that was it pretty much for tracking, straightforward behavioral data. Just wanted to briefly talk about and mention some different ways in reporting through TheraP, not using that specific behavior module. A lot of people will use the ISP programs, especially with, monitoring, restrictives, maybe IP goals, daily schedules, anything like that that might need kind of a different graphing or scoring method. So I'm not going to go directly into that today, but just wanted to put that out there that if you did need to track, something a little differently to utilize the ISP programs, and you can, when you go into create it, it's straightforward, really lists everything out for you, and you can make it very individualized. You can create your own scoring method. I just have an example here where it's just a yes or no. Maybe you need to track how many times something occurred this month. Maybe you need to track verbal prompts versus, independent. So you can really individualize that, and you can also create one of the responses as, maybe not applicable, maybe already occurred, and can have that be non-reportable. So that when you're actually, displaying your data, you're not having to worry about adding extra zeros or adding extra no's. Anything that, didn't have to occur for that time, it's not going to negatively affect your data. So you can go to the next page. It's just a small example of how the ISP data can graph. So in this example, it's, just measuring, the first one shows a percentage and the second one shows, a trial count. In this case, this person has room searches for a certain reason, and staff, checks the room daily. So you can actually see that, in the second month here from April, it's a little shorter than the other two because 2 days are missing. That person, maybe they were leave of absence that week or that month. So it's not negatively affecting them and staff's not just having to put a 0 or a no in for those extra 2 days. But yeah, again, you can pull, percentage for that. You can pull the trial count. And this is, good again for tracking restrictives, maybe tracking some IP goals for licensing, or, when you don't need just that straightforward behavior data. And I think that's about it. Yeah.
Yes, thank you, Amy. Sorry, we got frozen there for a bit.
No problem.
So just to kind of wrap up, just some do's and don'ts. Make sure you have valid data. That's always important. That what you're putting on those graphs is something you can rely on. I know it's rare that it's 100%, but do your best to try to get reliable data. Send at least a year's worth of data with baseline included if you're submitting to PRC, or data since the last PRC review is best. If there is a reason to send more or less, if you could just add a brief explanation as to why. Sometimes you need more to show if something significant happened 3 years ago or something. Provide both the numerical and graph data that's easy to read and interpret. Include all target behaviors listed on the PRC cover sheet and all restrictive adversive interventions listed in numerical and graph format. Choose a measurement system that makes sense. For example, using a frequency count when rates of behaviors are low and can be counted each time that they occur, or percentage when opportunities vary over time, or duration when how long the behavior lasts is concerned, whatever makes sense for that target behavior. Be sure to include all significant changes, meds, behavior program changes, life events, serious illness, etc. on the graphs. Use your data and graphs to determine effective treatment, not just for PRC presentations, but for your program development, for your reviews, etc. Make sure that you're including data to measure symptoms being treated with medication, such as hallucinations, sleep, depression, etc. That's what the medication treatment plan says the medication is for. We're looking for some data on that. Do not include monthly, quarterly reports. Send in only the numerical and graph data that measures the behavior symptoms that that the treatment targets. Do not combine data with different measurement systems on the same graph unless you're using a secondary access and they are somehow related. Don't try to graph to appease personal preferences. Do what makes sense to support your program and treatments that's user friendly. And by that, I mean, you know, we've gotten something like that, you know, so it needs to be correct and it needs to be something that we can look at and make sense of, and more importantly, that you can to analyze your data. Don't set up data collection systems that are impossible for staff or family to collect accurate data. Don't enter 0 if there is no data. 0 is data. Don't send both the longitudinal graphs and the daily graphs if you do both, unless it's critical to your presentation. If it is, then that's fine. Do not start collecting data and graphing just days before PRC. You're going to run into trouble of getting what you need. It's too late at that point. And most important, just don't make it more difficult than it needs to be. So hope it was helpful, and that's it for the presentation. I hope there's some comments, etc. We can do questions and things.
Yeah, I was going to say, we can open it up for questions at this point.
So I see that Lundy put in a question. Please review adding a table to an existing Excel chart.
Okay, let me figure out how to stop sharing this to an existing Excel. Same way, you know, you want to click on in your graph when you click in it, so that you get this line around it and these little dots in the corner, you know you're in it. And then when you do that, this little chart element will pop up, plus, and then click on data table and it will be there.
For people who are asking if you can access the recorded presentation, yes, you will be able to do so.
This is Tabitha Rivers. Are we able to get a copy of the presentation, a hard copy?
Well, it will be shared, so if you wish to print it, you could do that.
I see. Thank you.
Sure.
I just have another question while I'm on. In the Thera portion of the presentation, where comments are able to be made, is it right on the graph, or do you have to put it in somewhere before you actually while you're setting up the graph? Does that question make sense? Just as you have to put in all the other identifying information you're looking for, would I put that in prior to pressing submit and getting my graph, or after?
So once you've generated you've put in that initial, information, it's going to pull you up to a page, and it's going to automatically show up as comment. It'll be open that you can just type it right in,
Okay,
and then you can just hit save.
okay, thank you.
It should be right there.